Buswan Scott. Okay, do I suggest medicine for a person newly diagnosed for MS, 26 years old? Yes. I recommend medication for anybody that's newly diagnosed with any disease state that requires medication. They have phenomenal medications now for MS. They have pills, they have injections. Some injections you take daily, some injections you take once a week, some injections you take once a month. So there are various therapies depending upon the type of MS, if you will, the stage that you're in when diagnosed, and how you're going to respond to therapy. So very important that you start therapy as quickly as possible, because MS is a progressive neurological disease that can start off with generalized weakness. I have a patient now that has lower extremity weakness, is starting to have problems falling, cannot lift his leg up high enough to get into the tub, or more importantly, to get out of the tub or shower. And so he's at risk for fall every time that happens. So it's very important that you start treatment early to minimize the symptomatology. You can slow the progression. MS is a progressive disease, and MS is multiple sclerosis. Multiple sclerosis, again, I think is being overdiagnosed in this day and age. There's not necessarily an MS test per se. MS is a diagnosis of exclusion. We have looked for other things. It's not those things, so we're going to call it MS. There are some definitive testing that can be done with brain plaquing, etc. But more importantly, just with blood tests, etc., there's no definitive way to diagnose it, but the diagnosis is made based on your history, your presentation, and the signs and symptoms that you have. So again, one of the things that they do is start people on medications for MS, and if their symptoms improve, that answers the question as to whether it's MS or not. So great question, Vaswan.